So hello, my name is Salomon Manier. I'm a hematologist in Lille University in France. We have been presented the linker MM2, the cohort carfilzomib at ASCO this year. Medical needs in multiple myeloma in the relapse setting is clearly important. So we have made great improvements in the treatments of multiple myeloma in the past 10, 15 years, and recently with the new generation immunotherapies, CAR T-cell, bispecific antibodies. However, the patients still relapse. And we know that it's even more a challenge for patients with already 3 or 4 lines of treatment who are exposed to the main class, so triple class exposed, as we say in multiple myeloma. And so for those patients, there is a clear need for new treatments or new combinations of treatments to be able to control the disease in a more prolonged manner. So linvoseltamab is a bispecific antibody targeting BCMA and CD3. BCMA is the main target for immunotherapies in multiple myeloma. It's expressed quite exclusively in late B cells and plasma cells. So we have data with CAR T-cell and bispecific antibodies, single agents, so targeting BCMA, showing a very good efficacy. And here the question is to combine this linvoseltamab to carfilzomib. So carfilzomib is a proteasome inhibitor. We actually reported 2 different cohorts of linker MM2 during ASCO. One is in combination with bortezomib, the first generation proteasome inhibitor, and this one is in combination with carfilzomib, the second generation proteasome inhibitor. And that's interesting to observe a kind of synergy between this bispecific antibody and the proteasome inhibitor with some immune mechanism that we didn't expect initially, but are proven to be very interesting. So linker MM2 is a basket trial of linvoseltamab in combination with different agents used in multiple myeloma. So we have reported at ASCO 2 of the cohorts of linker MM2, one in combination with bortezomib and the second one in combination with carfilzomib. So the patient had received at least 2 prior lines of treatment, and in median in the cohort of carfilzomib, the patient had received 3 prior lines of treatments. So the range goes from 2 to 6. The data are quite interesting in both of the cohorts, suggesting a kind of synergy between the bispecific antibodies and the proteasome inhibitors. But there are much more combination with immunomodulatory drugs, with gamma secretase inhibitor to try to enhance the expression of BCMA at the tumor cell surface, with immune checkpoint inhibitors. So all of them in combination to linvoseltamab in different cohorts of linker MM2, but those other cohorts will need more time to mature and have data. So in this cohort of linvoseltamab and carfilzomib in combination, different doses of linvoseltamab were evaluated: 100 milligram, 150 and 200 milligram in combination with the full dose of carfilzomib as we know it. So 23 patients were included and were reported in this cohort. The median age is 70 years old. And I think there are 2 important aspects of the cohort of patients. One is that 40% of the patients were above the age of 70 years. And the second one is that close to 50% of the patients had a soft tissue plasmacytoma, so real extramedullary disease, and we know how challenging is this population to treat. 91% of the patients were triple class exposed, and 55% were even triple class refractory. We see a favorable safety profile. No safety issues were observed, so it's similar to the safety profile of linvoseltamab alone or carfilzomib alone, the most frequent adverse event is CRS on top of the hematological usual adverse events. And regarding infection, we see about 40% of grade 3-4 infections with a kind of long follow-up because it was more than 14 months of median follow-up in the cohorts. So the efficacy is quite remarkable. Overall, we have 90% of response rates. Some patients were not yet evaluable for the efficacy. It was 21 patients evaluable for the efficacy. And among those patients, actually, the response are quite prolonged, and only one patient actually relapsed under treatments. So we believe that this data is very interesting, confirm again the interest in the combination of bispecific antibody targeting BCMA here and the proteasome inhibitor, and specifically carfilzomib. So usually for this population of patients, we observe with bispecific antibodies alone about 60% of response rate. So this seems to be quite increased. And actually, some of the patients who were non-responder actually didn't have a PET-CT evaluation. So, some of them are even potentially responders. So we'll see in the future if this response rate goes even higher than the 90% with more follow-up. This warrant future developments, and there is an ongoing phase 3 trial evaluating this combination of linvoseltamab and carfilzomib.